go. Okay? Condyle the mandible, and when I go through this, I'll shut up, except for naming anatomy. Hold on your video, okay? Put on pause. Is that sometimes I'm going to give you a landmark. If I say condyle, the reason I say that is because it helps you remember temporalis. Okay? So now begin filming. All right? Temporalis, muscle over here. Condyle of the mandible. Mastoid processes over here, air cells as it were. Continuing down, both left and right side, I have temporalis here and temporalis here, because here are both condyles over here. Vessels are not quite seen showing up because we're still near the upper portion or the lower portion of the skull, posterior fossa. Ramus now appears over here, and with the ramus, you're also going to see the pterygoid hamuli, okay? And because of that, we're going to have the first of the pterygoid muscles attaching to the medial aspect of the ramus, namely the lateral pterygoid muscle. Always lateral to the ramus is going to be masseter. So we have lateral pterygoid, masseter, ramus of the mandible. These are still transitioning in, and of course the air cavity will be nasopharynx. Continuing down, lateral pterygoid muscle, masseter, ramus, pterygoid hamuli, nasopharynx, anterior arch of C1. For the first time, more clear on the patient's left side, the largest vessel in the neck, internal jugular vein, anterior to it, internal carotid artery. Mastoid processes over here. And what may be thrown out over here, which looks like a vessel, in reality is the first portion of the upper odontoid process, which articulates with the anterior arch of C1. Retraction of the lateral pterygoid muscle, which means that we're getting out of our field of view. So it's going to go away, that something else will show up in its absence. Masseter, nasopharynx, internal jugular vein, internal carotid artery, anterior arch of C1, the odontoid process over here. For the first time, we're picking up the parotid gland that has a characteristic mixed attenuation we spoke of, nasopharynx. We'll get into traps here in a moment. Nasopharynx, internal jugular, internal carotid artery. Now we see re-expansion of a muscle, continuation over here, transition into the medial pterygoid muscle, running between the pterygoid processes to the medial aspect of the ramus. Always masseter over here. More of the parotid gland, internal jugular, internal carotid. Don't be fooled by these, which are bony temporal styloid processes. Over here we have transition starting to show up, which will turn out to be, you can call them either way, retromandibular veins, which is a little bit more correct, or external jugular veins. And also you're seeing some transition over here for the sternocleidomastoid muscles, which we abbreviate SCM. Over here, much more evident medial pterygoid muscles all the way down to the body of the mandible. Masseter, same thing, all the way down. More parotid gland over here. We have two air-filled cavities. The one over here is nasopharynx or nasal cavity. Posterior to it will turn out to be here in a moment the oral pharynx, internal jugular, internal carotid arteries over here. Early transition of retromandibular veins. These teardrop structures here will become SCMs that will become an important landmark that helps us distinguish certain vessels of the neck. The presence of the uvula tells us we reached oral pharynx here. Medial pterygoid, lateral pterygoid, the masseter, internal jugular vein, internal carotid, parotid glands over here and here, which, again, your choice. You can call these now for the first time either retromandibular veins early on or external jugular veins. External cleidomastoid muscles appearing here. These are the trapezius back over here, and I think that's it at this point. Keep in mind, as we go down until we hit epiglottis, it will always be oropharynx. That's what we're seeing over here. Right over here, tongue. Here's the first time we see the carotid triad. That's an imaging term, but we go from posterior to anterior, internal jugular vein, internal carotid artery, external carotid artery, that triad package over here, SEM, lateral to it is going to be external jugular vein. Trapezius over here, residual parotid gland, always oropharynx until we get epiglottis. More triad over here, seen on the patient's left side, internal jugular, internal carotid, external carotid artery, ignore the superior thyroid artery over here, focus on the triad we just talked about, SCMs on both sides, traps back over here, oropharynx. Okay, and these still are the last bits of the medial pterygoid muscle and the masseter. They'll soon disappear. Here's the SEM, and over here is, on the opposite side, the external jugular vein. Continuing down, okay? Same thing as before. These guys are beginning to transition. We're looking for that to change. The triad, the carotid triad, always remember the order. Internal jugular, internal carotid, external carotid arteries, SEM, lateral to it, external jugular vein, oropharynx over here, trapezius back over here, some glands. And now we're seeing the early transition of the second pair of salivary glands found below the body of the mandible, namely the submandibular glands are starting to show up better on the patient's right side than left. Continuing down. Same thing as before, nothing really different, so I'm not going to spend a lot of time on that. But we do both see, or we see both of the submandibular glands. Now here's one out here called the anterior jugular vein. The anterior jugular vein drains blood from the lower lip area and the chin. It's going to eventually join up with the external jugular vein. Keep in mind, the internal jugular and the external jugular never unite. Here's a triad. These guys are beginning to go through a transition here in a moment, and we'll see what that turns out to be. Beautiful. Beginning of the larynx. Evident by the presence of epiglottis. These two recesses over here are called vallecula on either side. Here, on patient left side, transition into what will turn out to be carotid sinus, internal jugular, SEM, external jugular vein, again anterior jugular vein, external, and keep in mind epiglottis. When I see epiglottis, I always associate those two recesses or pockets with the vallecula. Yes, sir?
What is that like L-shaped line that's in the
Here? Lord only knows. Okay. I never saw that before until something must have happened on that slide.
Okay, I just wanted to make sure.
It's an L. Someone left their left marker present, and they swallowed it, perhaps.
I think I'm on the wrong side.
All right. Keep in mind, whereas this was transition over here, when I see a large caliber, a large diameter vessel, after that blur transition, it's called the carotid sinus. Whereas on the patient's right side, I see still the triad, internal jugular, internal carotid, external carotid arteries. You see what's left of epiglottis and vallecula, little tongue up here, things like that. And then anterior jugular, external jugular vein near C4, that general area. Here, if you recall the diameter on the patient's left side, it was large, it reduced in diameter. This is now the left, I'm sorry, it will be, yes, the left common carotid artery here, internal jugular, this guy, on the patient's right side is beginning to go through transition. Okay, well, it's really nothing yet. These are laryngeal folds, mucosal folds in the larynx, kind of chaotic. This is going to turn out to be the first bony structure of the larynx, which is a bone outside the larynx called the hyoid bone. Just from general purposes, this over here we call the myohyoid muscle. It helps elevate the base of the tongue along with the hyoid itself. Characteristic, you see the rounded anterior wall, characteristic of hyoid bone, okay? These are submandibular glands, anterior jugular veins, over here the externals. Look at the diameter difference on the patient's left side over here, smaller in diameter, which now says to us it's the left common carotid. Over here, larger diameter, it's the right carotid sinus, okay? Traps back over here. And for the first time, we're seeing a couple recesses, which we'll see here better as we go down. Over here are two areas that are important. These are called pyriform sinuses or recesses. Certainly don't confuse them with the vallecula, which is, these guys are more inferior. The residual of hyoid bone, a little sternal hyoid muscle, we don't need to worry about that. Submandibular gland, look at the SCMs always becoming more interior as we work from top to bottom. Okay? Both sides now, from this point down, common carotid arteries, both left and right. SCMs, external jugular veins, nothing beyond that. Traps. We call this the vestibular fold level because what you see is kind of vague, but what we see for the first time is a sharp angled anterior wall telling us we transition from hyoid bone to the thyroid cartilage over here. This vague appearance of soft tissues is going to be called either vestibular folds or false vocal cords. We have internal jugulars, we have common carotid left and right, anterior jugular vein, external jugular vein. The trapezius are very big over here. And what we've seen for a little bit, I need to call attention to it, is a collection of three muscle groups on either side of the spinous process. We call these collectively erector spiny muscle group. Okay. The next level is really critical because we call this level the true larynx. And the package I want you to remember is this: anterior thyroid cartilage, posterior cricoid cartilage, smooth, consistent shaped cords, thus we call these true vocal cords. The space between the true spinal vocal cords is rima glottis, and then posterior we have cricoid cartilage. Common carotids both left and right, internal jugulars left and right, SCMs and external jugulars down here. For the first time, we're starting to see these guys show up back over here. Scaling muscles, they're vague. We're not going to separate them into three of anterior, middle, and posterior specific scalings. Traps back over here, and erector spiny. Excuse me. The scalings are still seen over here. But the biggest thing I want to point out is that we've transitioned away from the larynx. We're going into a transition zone. This is the subglottic trachea, characteristic of that oval shape to it, not the true or classic trachea. Still part of the thyroid cartilage, a little early enhancement, a thyroid gland over here, common carotid both left and right. Keep an eye on the anterior jugular joining up with the external jugular vein. Continuing down, kind of transitional as well. Not much changing over here. Your traps are over here. Your external jugulars, your anterior jugular, more enhancement, a little bit more over here on the thyroid gland. Region of the esophagus become a little bit more evident over here. Continue down. At this point, I would call this trachea because you see that smooth or even pooched in posterior wall, which is membranous, esophagus, trachea, both sides becoming more enhanced, internal jugulars, external jugulars. Look how the two of these are coming together. And look how far anterior your SEMs have traveled. Yes, sir.
I think you said trachea instead of thyroid glands.
Thyroid gland, thank you. Thank you. Edit that on your video if you would. You know how hard this is to talk in my mature voice. It's killing me, guys, you know. Okay, I'm gonna go past this really quick. Try to get it right this time. When we get down to T1, we'll see C7 T1. We'll see the ribs. Okay, look at the unification of the anterior and external jugular veins, SEMs, internal jugular veins, common carotids, trachea, esophagus, and thyroid gland. Okay. And those are the major landmarks of the neck. Let me change now into the chest. Okay, we're at the level C7T1. There's a lot of beam hardening artifact over here, so nothing really becomes distinctive. But I use this as an example of where we left off on the neck and where we're beginning in the chest. Let me go down one level because these artifacts are too massive to get around. But what you see over here is this. We've injected contrast on the patient's left side over here. And we have a hard time seeing a lot of detail. But what we have on this side, and this should be one of your labeled images in your canvas course, is a collection of vessels that are going to be going through ongoing transition. From top to bottom, I have right common carotid artery, I have right internal jugular vein, I have right subclavian vein, and I have right subclavian artery. My recommendation, learn them in that pattern. We have trachea, we have esophagus, and on this opposite side here, on the left side, we already have an image of the left common carotid and the left subclavian artery. We'll get into this here in a moment. And we're going to focus primarily on, I didn't show you some muscles up here as well. I'll cover those right now. We don't get into a lot of muscles in the chest area, but we get two in the anterior chest, and of course the traps back here in the rectus spinae group over here. You have two muscles in your anterior chest, okay? Your bodybuilders, pectoralis major, and below it, pectoralis minor. So I didn't cover those, I apologize for that. From the standpoint of vessels, what we have left is right common carotid. You see the transition here at this point before you get underneath the clavicle is right subclavian vein. When the internal jugular and subclavian vein come together, they form the right brachiocephalic vein. Okay? Here, even though it's partial volume, is right subclavian artery. Opposite side, that transition's already occurred. This is the left brachiocephalic vein, left common carotid, left subclavian artery.
So that should be that should be
Okay. Very gradual transition in nature. Right brachiocephalic vein. And these two here give us a reminder of what's going to happen as we continue down. What's left are right common carotid and right subclavian artery, again, impacted by partial voluming. When these two come together, the right common carotid and the right subclavian artery, their product will be brachiocephalic artery. Only one, so it's not left or right. The remainder is the left brachiocephalic vein, left common carotid, left subclavian artery, trachea, and esophagus. Continuing down. Right brachiocephalic vein, transition of what's remaining of right common carotid and right subclavian artery. Left brachiocephalic vein, left brachiocephalic vein is going to arch over the anterior mediastinum as it begins to cross the midline. We have left common carotid artery, left subclavian artery, esophagus back here. Continuing down. We have the three branches of the aorta. We have, learn these in order please. This would be brachiocephalic artery from right to left, patient right to left. Middle one or second one, left common carotid. Third one, left subclavian artery. Please learn those in that order. Coming up and over is left brachiocephalic vein. Here remains right brachiocephalic vein. This can turn out to be mediastinal fat here in a moment, esophagus, and trachea. These are becoming transitional or vague. When they go away, we see the aortic arch. We have the right brachiocephalic vein, left brachiocephalic vein, mediastinal fat, which is the remnant in the adult of the thymus gland. Transitional, I'm going to move past that one. This is near T4, T5. We have the classic, if I could call it that, aortic arch. And for our purposes, we're going to call this now superior vena cava. Keep in mind, the right and the left brachiocephalic veins form the SVC. Here is going to be trachea, mediastinal fat. These are the three areas that really are most close to the esophagus and posterior to the trachea. Continuing down, I'm going to go down one more if I may. Here we go. Okay. Another transition has occurred. We're getting below the arch. And from our learning perspective, we have ascending aorta, most anterior, descending aorta, SVC. This region, for imaging purposes, is called the aortal pulmonary window. It's kind of a pathologic zone, as it were. And for the first time, we're seeing a small vein that drains blood from the interlumbar, intergastric, and intersplenic area called azygos. Between ascending and descending aorta, we have trunk of pulmonary artery, SVC. We see transition of trachea, descending aorta. Azygos kind of comes and goes. Beautiful shot over here. This is what we call in imaging the inverted Y sign. The main stem is pulmonary trunk or truncal pulmonary artery. Right pulmonary artery, left pulmonary artery. This whole thing collectively, we'll agree, we'll call it carina. Actually, just the ridge over here, and a very fat and sassy azygos, descending aorta. Ascending aorta, transitional heart stuff and pulmonary artery, we're not going to worry about that. We have both left and right main stem bronchi. Look how the left pulmonary artery leaps over the left main stem bronchi, azygos vein, descending aorta, SVC, and this little dot is the arch of the azygos vein, and again we talk about ascending aorta. Descending aorta, azygos, transition. Whatever chamber we pick up near the spine always will be left atrium. And these things that are linear, that point back to the left atrium, always are going to be pulmonary veins. Keep in mind there are 4 pulmonary veins, 2 on either side. Okay? Some will call this aortic root. You can call it ascending, I don't really care. And that space here is a recess or depression within the heart muscle where you have cardiac veins. We call that coronary sulcus. Okay, pulmonary veins over here. Going in, we don't see them well. And we're seeing the last of SVC, actually beginning of right atrium. You'll see some transition occurring, one more level. Pulmonary veins, again, pointing back to left atrium. And I'd like you to learn the heart in this manner, counterclockwise. Left atrium, closest to the spine. Left ventricle, right ventricle, right atrium. The inner ventricular septum, large, big, is going to separate the 2 ventricles from each other. Okay? And I believe we have one more maybe. If we're lucky enough, that's going to be it. Beautiful chamber of the heart, getting away from the atria. Left atrium, left ventricle, right ventricle, right atrium. Okay? And that's it. Lick.